Um, Today we're going to be breaking down support systems for new grads because if you guys didn't know, like, oh my gosh, the first year of being a new grad is so intense. I hear it so much and so often from the decades I've been doing, actually a decade I've been doing nursing. So today we're going to be giving you guys a lot of practical advice to number one, not burn out and to thrive as a new grad because it can be downright scary. So as you guys are coming in, please let us know where you're from and when
Mhm.
you graduate, and really even like what department you want to go into. But we are here to get the party started. With me today is Professor Alison, who has been a nursing professor and a nurse for over a decade, and now she travels all over the country to do in-person, not conventions, but in-person workshops for the NCLEX as well as exit exams. So welcome, Allison. Thanks so much.
Thank you. Yes, NCLEX prep all over. Oh,
Oh yeah,
wonderful. We have some just graduates, started new residency on a tele unit, New Jersey. Wonderful.
nice.
Someone from Canada. Florida
Very,
graduate already, looking at a few different areas.
I love it.
Ooh, we got a New York. Wonderful.
We got a New York.
Ooh, Massachusetts. So we have East Coast is covered a little bit.
When do you guys want to, or not when, but when do you guys graduate, and then what department are you guys planning to go into? Let us know. I think I have like a little feedback on. Let me try to adjust something here.
Florida graduate, looking at ICU, a lot of ER ICU people. I love it. Which is so funny. I feel like I know like a very antiquated thought process used to be, or at least I remember a lot of my clinical instructors saying like, new grads can't start in the ICU or new grads shouldn't start in the ER, things like that. And we now know that's so not true.
So not true. You know what's funny is like if med surg was the only thing that nurses did, like I probably wouldn't become a nurse because I love emergency medicine. Everyone has their
Mhm.
own thing. I've heard the same thing with nurses who worked with pediatrics and mother baby, and they tell me the same thing. They're like, if it was just adult patients or whatever, like I wouldn't do it. So I'm like, oh yeah, that's interesting. And that's why we're trying to show you guys that as you already know, nursing is just a huge world, and there's so many opportunities. But really, to get to those opportunities, you have to understand some basics. To really, number one, how to pace yourself, and some practical tips that no one really shows you as a new grad. So, yeah, let's get into it.
See, we have a lot of Canada today
Oh, really?
and a few Florida.
Nice. Now, as a big side note, guys, we have just launched our new grad membership course, which includes 30 hours or basically 30 videos of deep, in depth topics of everything you need to know to master your new grad position. And so, what we did was we sat down with some of the top hiring managers from Ivy League hospitals around the country. We're talking Cedar Sinai, University of Maryland, as well as the City of Hope. And let me put this down here. And we sat down with the hiring managers and like, yo, what do you ask for your interview questions? What do you look for in a resume? What would be the
Mhm.
best candidate? And they just spill their guts and all their tips to us. Then we went over to the preceptors and we're like, where are the top areas that these new nurses mess up and how do they avoid it? And then we also went to new graduates themselves who had just fresh out a year of experience and we got their perspective and their top tips. Then we put it all together in this course and then we marched out and did dozens of more videos that show you how to manage your stress, show you how to say no or even ask for help, and also how to prioritize, also how to give a report, a shift change report, which is very
Mhm.
scary. And then we also give you guys right here the skills refresher library of over, I think, 20 different skills that wraps it up in 60 seconds. So, because so often we hear, when you're on the floor,
Mhm.
and your first day on the job, your first week, like I hadn't done an IV in like years because I worked as a tech before I was a nurse, and you can't do IVs. But I mean, I would practice like my brother and things like that. Literally, the first week in the ER, I was starting 7 IVs in the first few days, and I'm like, I've never done this before. They're like, you're gonna do it. I'm like, oh my gosh! So I had to look it up, and I was trying to find resources and scrambling with huge long YouTube videos. and like poking around. So we include about 30 something videos, I think 20 something videos of the top skills you need to know, but we wrap it up in 60 seconds really quick. So if you're given something, just be like, I'm gonna use the restroom real quick, or I'm gonna go to the break room, or not break room. I'm gonna go to like the utility closet, watch it for 60 seconds, and like, okay, I got this, So, anyways, this is our baby. I'm really excited about it because Simple Nursing helps you through nursing school. Then we help you with your NCLEX, and it's so naturally, all the other companies that help you with your NCLEX, you know who they are. They just drop you off, like an orphan child, and be like, "All right, that's about it. We can't help you any further." So
Mhm.
it was on my heart that I was like, you know what? What's next? How do we help these nursing students who are now nurses? Wouldn't it be cool if we made some resources to help them with their career?
Mhm.
So that's exactly what we did. Nurse Alison and I collaborated on this, and we also had Nurse Lauren. And the best part about this whole thing is that you can get CEUs for taking this course, because remember, every 2 years you'll need CEUs. So it's just a fun way to get it all done and be really helpful.
Mhm.
We do have a discount code at the very end if you're interested, but you can always just try it out for free. We have a few free videos on YouTube. And it's pretty helpful if you are very nervous about starting your new grad job. All right. So, what to expect from this session is we're going to really just get real about the challenges of transitioning from nursing school to the actual real world. Professor Allison can probably agree that, you know, actual nursing school is nothing like the real world of nursing or nursing.
That's
And
pretty true.
right. I mean, like, because I mean, nursing school, it's almost like driver's ed school, right? Remember,
Mhm.
like, you had that person next to you watching every move. It's like, okay, hands at 10 and 2. Look, use the blinker, everything. But when you're actually in the real world, you're just like driving, like chill, like, what's up? Blasting your music, doing your thing. It's the same thing kind of like with nursing. And so we're going to give you guys expert advice about support systems that can really help you transition from like that, very strict to now like more loose, but more fluid and more intuition. Because a lot of things that in nursing, especially when you're onboarding, they teach you the clinical skills or like those hard skills, but the soft skills of juggling and managing and talking to doctors or asking for help or what to do if there's a conflict with so and so. We're going to show you guys how to do that. And lastly is answering Q&A questions. So remember, post your question anytime, but try not to put it in the general chat, because if it's in the general chat, it's going to get lost in the sauce and we're probably going to scroll right past it. So if you can, put it in the Q&A button and we can answer those when we start answering Q&As. Cool. I think I just uncovered everything. Okay, yeah, use the chat button for any tech issues. And if you're joining from YouTube, here it is. Submit your questions in the comment section, and then we're going to be able to address them if you're on YouTube joining us. All right, guys. So this webinar is just to remember you're not alone. Nursing is the biggest family. We call it the nursing mafia because it's like 80% of the hospital. But there are support systems and best practices when starting on your new position. And always remember this, guys. Out of all the new grads we interviewed for that new course, our new grad membership course, they always said it's like be kind to yourself the first 6 months. The first 6 months of nursing, you're gonna feel like you're an idiot. And the theme that kept on coming up, it's almost like a motto now that I use. It's like, listen, I'm not dumb, I'm just new. And giving yourself grace to learn, because once you get that learning curve, then it's like you're at cruising altitude. But don't be so hard on yourself as you're learning that new skill. So first up is getting into why support matters as the new grad nurse. So I'm going to start on this left side of the screen. So as you guys know, starting your nursing career can feel downright overwhelming. I kind of liken it to like jumping, like bungee jumping or skydiving, because it's something that you never done before, or if it's your first time doing it, it can be really scary. A lot of firsts are very scary. But again, this webinar, we're talking about how strong support systems, they make all the difference. We're only as good as the team we have. So it's best to not be the weakest link on the team. This is why a lot of veteran nurses who have been on the department for 20 years, a lot of them don't enjoy new grads because it's like, you're the weakest link. You're slowing me down. And you have to
Mhm.
understand as you're coming in, it's almost like you're going into someone else's house who like has been there for decades. And so, that's why I always say big ears, small mouth, and then start getting on the side and start winning their favor because it's all about teamwork. You do not want to get the team kind of against you, if you will. So, bullet point number one is transition to work can be emotional. I've heard so many nurses or new grads just crying after every shift, and that's normal. It's okay not to be okay. That is one of the biggest lessons. So many times we hear feedback stories of people who used our products and passed the NCLEX and are saying, "Thank you, Mike, so much," just to find out, the first 3 months of their career, they want to quit because they're crying. The nurses are mean. And it's like, it's overwhelming. They can't even go to sleep because they hear like the call bells so much. But guys, it's just you're new because you're not used to it, if you know what I mean. So give yourself a lot of grace, and we're going to show you how to navigate this. So it can be downright emotional, clinical, and there's definitely social challenges. But again, support helps reduce burnout and feelings of isolation. Do you have any recommendations, Professor Allison, on what new grads can do to like have an outlet or like a release valve or some type of?
Definitely, because like even some of the social challenges you don't think about, because lots of times, like when you're in nursing school, you guys are kind of all in it together. And because you guys, start out the same or you're in the same cohort and whatnot, so you feel like you're going through a lot of the same things. And sometimes as a new grad, it can feel like maybe the people that you live with don't understand the things that you're going through, or maybe you're working different hours than they are. Like for example, when I was a new grad, my sister, we were roommates and she was in law school, but I worked night shift. And so she would want, me to be able to do things that I couldn't do. And so what really helped was especially like bonding with other new grads, bonding with people in my unit. So that way, then there were times where there were people I could vent to, because especially, my sister didn't want to hear about, some of the things that I was that she thought were gross that I would, have happen on my shift and whatnot. So especially like trying to, build that support, it's going to help to have an outlet and it's going to help you to feel like you have people to go to, people to lean on, and people who are going through what you're going through. Again, in the trenches, kind of like in nursing school.
Yeah, I mean we call it like the band of brothers, or you call it like your nurse family. You can get really close because I think the best part about starting as a new grad is usually there's other new grads starting with you, and so you
Hmm.
don't feel alone, and you start like trauma bonding, if you will, to them.
You're right.
But then here's the biggest thing, biggest advice: try not to do too much of the extremes. Try not to do too much caffeine. Try not to do too much drinking, especially if you're like, oh, it's just wine. Guys, it's not good coping mechanisms because one, the caffeine's going to burn out your adrenals, causing even more stress and more fatigue. And then alcoholism, it's going to make you feel like crap, and then it could lead to dependency. So just pro tips. All right, moving on. Kicking the ball over to you, Professor Allison here.
Absolutely. And again, if you can put your questions in the Q&A, because we can address some of them, we'll address live, some of them we can answer directly to you, just that way it doesn't get lost in the chat component. Because we definitely want to answer all of your guys' questions, whether it's, about subscriptions, things like that, or whether it's about, I see a really good one about a preceptor, and I see another good one about restraint. So we're going to answer all of those. So please put those in the Q&A so that way we can make sure that we hit those and everything. But so other reasons why support matters, again,
You're
because
right.
it's going to help. Oh, sorry.
No, it's okay. Go ahead.
Oh, so because it's going to help, especially when you have really, really intense shifts. Or say, like, for example, I remember my first 6 months, I had a patient pass away. And so, especially having that support of the other staff, to even someone to say, if you need to go take a break, decompress, and then come back. I'll watch your call lights, things like that. So, having that support can really, really help, especially if you have a code situation. Like I remember my first time, having a patient who had a code and needing that support because I felt like I didn't know what to do. I felt like I was kind of spinning around in circles. Like, okay, what should I do next? What should I do now? What should I do now? And so having those other people there can really help you through that. also the fact that, being seen and heard and feeling like what you're going through is not abnormal, that, you're not, you know, that you're not a weakling, that you're not, you know, bringing the whole team down because other people have been through it. Everybody's been new before. So, as a new grad, you get to be new. We say that all the time. And so it's okay. You're going to have a lot of firsts. And that's why it's so important to have that support to help you during those times, because then it's going to help you to recover more quickly than beating yourself up and whatnot. Or, asking, thinking, what if, should I have done this differently instead of this? And they can provide you that feedback, okay, in the future, what should I do differently? And so it's going to help to build your resilience. It's going to help you not to feel so down on yourself. If you feel like you made mistakes, you didn't do it perfectly, that's okay. Because again, you get to be new. And when you get to be new, people are there to help.
Hmm. I think that's the hardest part about new grads. It's like it's really hard to ask for help too, right? Because it feels like you don't want to be a burden. You're already kind of new, and everyone's like, "Oh, you're the slowest person on the team." So I
Right.
think one of the biggest tips we always talk about is what was it? Can you guys see my face, by the way? It looks like,
No, we cannot.
oh my god. Well, that stinks. All right, I can probably refresh something when we get to the next slide, but that stinks. I didn't even know this whole time. Okay, anyways, um, one of the biggest things is to win veteran nurses on your side is to what was it? Get something for for the staff. For example, like cookies work the best. You can bring in some type of like pastry or something that's sweet, like donuts. I know it's not the best for like the body and stuff, and like whatever. But the beauty of it is that since you're new, and since you're trying to build rapport, and you do feel like you're a stranger in someone's house, the best feeling in the world is like when so and so, the charge nurse or one of the veteran nurses, says like, "Hey, who brought the donuts?" And then so and so, one of the other nurses says like, "Oh, it's the new guy." And you're like, "Wow, thanks, new guy." And then people start opening up to you and start cozying up. I've seen it multiple times, and it's a pro tip for sure. All right, next, go to the next one here. All right, before we do this one, let me see if I can change something here.
Absolutely.
Oh,
And while you're doing that,
yeah.
so I see a question. So if you're burnout in one area and trying to transition to another one, it's not as hard as what you would think. Because I worked in float pool for many years, and especially, having experience in multiple different units makes it so that way you are a little bit more flexible and can adjust to things like, okay, I need to figure out where the med room is now. What are your priorities of things to get hammered down and everything. But definitely, rely on, because usually when you switch to a different unit, oftentimes there is at least somewhat of an orientation. Even if you have that previous experience, they'll do someone, it might be truncated, it might not, it won't be as long as when you were a new grad. But, use that orientation time to help you with that transition. And luckily, especially it looks like if you have a variety of different experience in different areas, that's going to help you and that's going to make the transition. It's going to be different, but it's not going to be completely brand new. So you'll be able to use what you've had before in the past and help that, but just tweaking it to a different patient population.
Yeah, like I think the biggest thing is finding the cadence of nursing because just like you said, transitioning to a different population, once you understand like, how the nursing flow goes, then it's kind of like, what I like to say, it's like the same exact diaper, just a different poop. Same stuff, different diaper, and rinse and repeat. One of the best ones is to actually be in a float pool, right? Like you can actually see the hospital, like a lot of the different
Absolutely.
modalities. Mhm.
Absolutely. And it makes it so that way you don't, lots of times, especially as a new grad, I did need that time of like, okay, here's what my day looks like. I go in, I know where to find my patient, my patient list. I know to look up my patients, do this, this, and this. And I would have this exact rhythm. And then you'd get floated and it sets you off your rhythm. Especially, I felt like at first I was always getting floated when I was like the third shift of three. And I was coming in excited for that, to have that third shift of three in a row or the fourth of four in a row and thinking, oh, I'm gonna probably get my same patients or close to, so this is going to be easy peasy, and then whoop, I'm getting floated. And so it helps you not to be so rigid. And
Mhm.
so that way you can, quickly shift gears and oftentimes you just kind of make it work.
Mhm. Yeah, that's the biggest thing about nursing is like you just have to make it work. Wait, let me switch over. I have my screen on another platform, so let me just take off this ghost mode if you guys don't mind. Hold on just a
Yeah,
sec.
absolutely. And I see there's a few questions in the Q&A about tutoring for like NCLEX and nursing school. Actually, come back or tomorrow we will have on Thursdays when we have um, our NCLEX prep in nursing school prep. And we talk about like test taking strategies and what to do to prepare for NCLEX, like how many questions you should be doing on whichever platform you're using, what scores you should be getting in order to know that you're ready for NCLEX. So definitely tomorrow is a great one for that if you're looking for NCLEX nursing school. We have so many different tips and tricks, especially with breaking down different types of questions that you see on exams and what to do if you don't know the answer, how to still break it down and potentially get to the answer.
Yeah, yo. Can you guys hear me now?
Yes.
All right, finally. I'm so sorry about that. It's just technology, man. Technology. All right, so I had to reboot from my phone. That stinks. Okay. Anywho, I wish AI can just like help everything out now. Come on, just fix it for me. All right, there we go. How's that look? Are we good? Okay.
Great.
So following up with this, it's all about the support system. Lean on fellow new grads is what we've been talking about if you're just tuning in. And, you know, remember, remember, it's not that you're dumb, it's just that you're new. Okay. Because don't beat yourself up when you're trying to learn something new. So the last 2 points here is to give and receive feedback with empathy. So many times we can take it as a personal dagger. So whenever you're given like
Mhm.
some critical feedback, and trust me, some of these veteran nurses can like lay into you and give you like some real deal, real life feedback. It's like, oh snap. But just remember, like, you're the new person, and there's going to be a lot of personalities
Mhm.
that you're going to be dealing with. And just remember that think about it as like a learning opportunity and instead of like an attack. But again,
Mhm.
receive feedback with empathy to encourage thoughtful reflection. And again, it sharpens your practice because as a new grad, you're not going to be perfect at everything. The first 6 months, you're going to feel like, why did I even do all that schooling just to be here and not know even how to be a nurse?
Mhm.
So remember, it takes time. Give yourself a lot of grace that first 6 months. And I think one of the biggest things that nurses and even us as well, not us, but you guys as nursing students that just graduated, it's really important to celebrate milestones and stay
Mhm.
motivated and encouraging. So celebrate like your 90-day probation period or celebrate your 6 month.
Mhm.
I don't see a lot of people doing that. They just kind of expect to get to the next phase, to the next phase. Now I got to go nurse practitioner. Now I got to go to CRNA school, and it's like, guys, slow down. You know.
Right, absolutely.
Hmm.
Like let each phase happen because then you're going to feel more comfortable and confident. If you get, you get your feet under you and you get that firm setting, you start and it'll build that confidence over time for sure.
Hmm.
Um, So yeah, especially I think celebrating milestones, even like on a unit, is so important. And even if it's little things, even if you're the one bringing in the treats for your own milestone, it still gets everyone else's buy-in and gets, can help to get a little bit more a little bit of recognition for how far you've come.
Oh yeah. I honestly, and I know it sounds bad, but we all know it's true. Diabetes. No, when you bring all the treats and snacks, it really goes a long way, especially when you're on a 12-hour shift. And even though I always like, I'm never gonna eat it, you end up eating it. So yeah,
Sometimes that little
it's
sugar
nice.
boost that can also get you through, you know, if you haven't had a chance to have lunch
Mm,
and
yeah,
it's 8 hours in and a little bit of a sugar kick can help to, boost your energy level
yeah.
and kind of get you through that next part.
And if you're doing what am I saying? If those nurses that already kind of like annoyed that you're new and you're slow, if they get that sugar boost and now it's like a
Mhm.
neurochemical thing and maybe it releases a happy chemical that's like, oh man, that's the new grad that did this. I like this guy. So it's nice. Okay, so let's talk about preceptors and mentors. So, as you guys know, a preceptor is your field training officer that basically is training you to be a new grad. And they monitor you, they show you the unit, and it's usually for about 12 weeks, 90 days.
Mhm.
There's good preceptors and there's horrible preceptors. The first time I started as a nurse, I had a really bad preceptor who just did everything for me. And I was like, what am I doing? Like, I need to practice. And I would tell her. And she's like, no, we don't have time for that. I'm like, well, I'm going to be on my own in like literally 4 weeks. And I still don't even know how to hang blood. Or I know how, but I haven't done it in like
Mhm.
since nursing school, like one time maybe. And so I was nervous for my license. And so, you have to escalate where escalation is necessary. And I raised my hand and I got a new preceptor who was better. So this is why preceptors and mentors, you have to build those meaningful relationships
Mhm.
with those nurses who know what they're doing, because it can speak volumes. They can guide you clinically and emotionally and help you navigate. Everyone should have a mentor. I have a lot of friends in business who have business mentors. Fitness people have fitness trainers and coaches, even though
Mhm.
like they're really fit. So it's important. So number one is to ask questions and debrief with your preceptor regularly. There's no dumb. What is it? What do they say? There's no dumb questions. There's just dumb people asking questions. No, I'm just kidding. No, but there are no dumb questions. You guys are learning. It's okay to learn.
Mhm.
The worst thing you can do as a new grad is going in, acting like you know it all, and then not really learn anything, and then you have your license on the line when you try to do something that you think you know, but you never done it before. You end up messing up. I've seen a lot of new nurses hurt people and get their
Mhm.
license in jeopardy. It's very dangerous. Another one is to identify a mentor who inspires you and who is willing to listen. You guys remember that old quote, "Be like Mike"? Be like Mike. No, it was it was a Michael Jordan. I feel like actually when I was doing entrepreneurial like masterminds and just learning about those groups, they would always say like find someone that you want to be like and start emulating them because humans work the best by emulating instead of like by reading books or doing coursework. We as humans learn best by with hands-on experience.
Mhm.
um, and so seeing someone do it and modeling yourself after them, it definitely inspires you. But Tony Robbins says it does something even more inside the brain. I think it's like the I forget what it's called, like the AMCC part of the brain where you actually learn something difficult, but you see someone do it, and then now you know it's achievable.
Mhm.
So yeah. And then number three is to clarify expectations. Mentorship doesn't have to be formal. The best type of mentorship is a little half and half, like respecting the person as your coach, but also having like a sprinkle or dabble of friendship and some type of like camaraderie. Um, I've seen it go bad if you have too much friendship, then they kind of let you slide and they kind of don't really teach you as much or not as educational to you. It's kind of
Mhm.
just like you're more of a friend. And I've seen it the other way where you're too professional and it's like boot camp and you're like, really stressed out. So those are my 2 cents.
So then some other things, especially, with your preceptor or with any mentors, be open to, feedback, be open to guidance, or even just like if you don't do something well, try it again. I remember like even something like, your first discharge. And sometimes it could seem like, okay, wait, I'm supposed to do what, and then what, and then what. And it's your patient's not as heavy, they're more stable, but it's all these logistical things that you have to do. But the more you do it, the better that you're going to get. And especially even sometimes with things that you're not used to doing, ask someone, can I watch you first? And then, watch how they do it and almost be like Mike, emulate that. Especially like if anyone helps provide you extra support, if they, let's say you're out of orientation and you're doing something you haven't done before, express gratitude for their time and for any advice and that continued support, even if you're technically out of orientation. Also, reflecting on that feedback with others, even things like sometimes someone will say, oh, I remember my first code or I remember my first this.
Yeah.
And so then hearing sometimes even their horror stories can make you feel better, and you can learn from that too. Because maybe
Hmm.
that wasn't a mistake you made or something that you did this time, but it can help you to know what not to do, and what not to potentially accidentally do in the future. I also saw a great question in the Q&A about preceptors. And it was someone asked, uh, is it normal to have a preceptor who's also the charge nurse with a full patient load? And that
Whoa.
can happen because especially if the charge nurse is probably someone who's been there for a while. And so oftentimes they try to have like experienced nurses who, do the precepting and whatnot. And so especially the charge nurse in the leadership role. So oftentimes it's because they're a good leader and someone who's good at teaching. Hopefully, we always hope that preceptors are people who like to teach, who want to be a preceptor, not just someone who's just been there for a while, but they hate doing it. You can tell,
Hmm.
when someone does not like being a preceptor. And, but especially, if you're not feeling very supported, because if, say, your preceptor is the charge nurse and has a full patient load, and so you're not feeling like you're getting as much support or attention, maybe it feels like, okay, I'm going to go do this. Now you go do this. You're dividing and conquering more than getting to do the work together and um getting the support in that manner. Speak up. Maybe talk to the manager and ask if you could, maybe one shift have some, have someone else mentor you or follow or shadow someone else, or have someone else precept you, so that way you can get that different experience and maybe get a little bit more of that hands-on support. Definitely
Hmm.
don't be afraid to speak up, because oftentimes they just may not know that that's the outcome it's having. And so speak up. It's hard. It can be really hard, especially if you are someone that tries to just go with the flow and you don't want to seem like you're complaining, etc. But remember, this is your orientation. And especially the most important thing that, the managers care about or that they should care about, is that you are getting the experience that you need. So that way you can go be on your own.
Yeah, I think that's the moral of the story, and I can speak volumes to that, where it's like, just like Professor Allison said, I wanted to jump in, but I didn't want to cut you off. I had that first preceptor, the first preceptor that I ever had as a new graduate registered nurse was someone who was being a preceptor, number one, for a pay bump, which was only like a few dollars. And then, but number two, the most important thing to her was she had a precept for a year before she can apply to be a flight nurse and go around the helicopters, like with Mercy One, and those kind of like advanced emergency cares. So that's why she didn't really have patience with me. She just like, no, no, let me do it. It'll be faster. So again, this is your license. This is your whole career. This is what you've been training for. So
Hmm.
don't let a preceptor just kind of push you to the side and not really teach you. You guys are worth more than that, and you should get as much as you can out of your what's it called, orientation, if you will, or your what do they call that? Orientation or preceptorship?
It can be used kind of interchangeably.
Mhm. All right. So next is finding belonging within your units. Now, the best analogy that I love to use here is the Mean Girls, because I've been on 9 different hospitals.
Mhm.
I've floated. I've worked registry. I worked staffing, which means that they staff with another company, and so you're brand new to the hospital, and you have to learn where things are at. You have to learn who's who. You have to play nice. You're literally in someone else's house because that's not your hospital, and you're just doing 1 or 2 shifts there. And they know that you're getting paid more than them, so they're kind of like bitter about that. Yeah, it's a lot, guys. So just imagine like you're like the new kid at school, and like all the cool kids are like, "Yo, who's this mofo?" Or it's like, "Who's this guy that's coming in?" So the before we even get into it, just think about yourself as being a guest in someone's house, and you're going to hear us saying that a lot. But the way to find belonging in a unit that you're going to stay on for a long period of time is to really observe the culture and understand how the culture impacts your unit and how to be supported and feel safe as a new grad nurse. So number one is to observe team dynamics, guys. Big eyes. This is why I always say big eyes, big ears, and small mouth. Observe, observe, observe. I've had multiple friends. My friend in California, I was going to say her name, but she will not be disclosed. Her first name is with an S. She actually got on the bad side of a hospital she was working at near Detroit. Um, and she was telling people what to do, how to do their job, because this is best practice. I just graduated from nursing school. This is best practice. And guys, like, if you have a big mouth and small ears and small eyes, she got a lot of nurses against her, and they were trying to find a way for her to make a mistake and then report her to the BRN. This is what I'm talking about. Like, this is like
Ah,
mean girl stuff. Like, it's
mhm,
crazy, and you have to know about this. So number one is observe team dynamics and who you can approach for help. You don't. The worst thing you can do is pull on the tail of an alligator, and there are some alligator nurses that are like
mhm,
very grumpy and very tired and have worked there for a long time.
mhm.
And so just know who the mother gooses are. Like, is that a term you guys use, Allison? Mother goose?
Yeah, yeah, I use the term
Hmm.
mother goose. Yeah.
Explain what a mother goose is, like, because for people who aren't familiar.
So kind of like someone who will see when you are sees that you're drowning and will you don't even have to ask for help, is already offering help or checking in with you, or checks in with other people, is offering to help. So someone who kind of has like that overall like, you know, kind of like mother and compassionate, caring feeling and
Hmm.
already has like a sense for when someone's drowning and checking in with them and trying to help.
Yeah. Yeah, and once you guys probably identified, I think everyone can identify an instructor that you had that was like, Mr. Grumps or like the
Hmm.
Grinch. And then versus the instructors that like will, really help you and stay after and like, really help you when you're in a pinch, right?
Hmm.
And we already know that about our nursing instructors. And it's the same way as your new coworkers who are like your veteran nurses, right? So
Hmm.
just be mindful. The next thing is really big. Every hospital I've been to loves potlucks. But your facility, you'll definitely be in huddles. Usually in the ER, we did a huddle or like a little team powwow before the shift started, and they would cover things like, here's where the unit's at, here's how much volume we've had, or hey guys, it's a full moon, which is really real. A full moon, the crazies come out or the werewolves come out, and just crazy things happen.
Hmm.
And it's kind of just like a little forecast and like a little powwow before you get your shift started. Um, but again, as mentioned before, potlucks, you do not want to be the person that does not bring anything to a potluck. That's the worst thing you
Hmm.
can do. Try to bring something that is delicious that everyone will like. You don't want to be the guy that brings the fruitcake that no one eats and throws away,
Hmm.
or the casserole. I don't know, whatever it is. But you want to be something, do something that's impactful, especially in your first 90 days, because you want to win over the favor of the unit. And I know it sounds cliche, but if you don't do it, I've seen it before, and I was there myself. You get the mean girls against you, and it's not good, guys. It's really not. It makes you kind of hate your job. So try not to do that. And then even team chats to build relationships. But
Hmm.
again, your first 90 days, you want to just be observant. You want to open up your eyes and ears and just look at who are the mother gooses. Try not to open up someone's crab shell if they're the cranky nurse and be like, hey, I'm going to climb over that anger wall and be your best friend. Like, guys, it'll probably backfire. And I've seen it before. It doesn't end well. And then last one here is what I did. Speak up respectfully. Contributing helps you feel included. But again, small mouth, big ears, big eyes. Because my friend, she got on everyone's bad side by telling people what to do. Like, hey,
Hmm.
this is what you should do. And this person's been there for like 2 decades. And like, what are you talking about? This is my job. Like, you've only been here for 2 weeks. So again, speak up respectfully to your preceptor directly, and try not to do with any of the others, because again, you want to build that rapport with the crew that doesn't know you and just
Hmm.
expects you to slow down the unit. So you need to win that over. You almost like start some units, you start at a loss, you have to, crawl yourself out, if you will.
Hmm.
Not all the units are the same, but again, it's better to be safe than sorry. So yeah. All right, moving on to the other side here.
So some other ways that you can find belonging uh, within your unit, whatnot, is find slower times or slower moments, and instead of I guess I know a lot of units they don't allow phones, but instead of disengaging, maybe like use that to try to, you know, earn trust by getting extra call lights that aren't yours. So
Yeah.
helping other people, not always being the one that's, asking for help, but also trying to give it when you can. Because that's going to build a lot of trust and it's going to make people more willing to help you without you even having to ask, especially if
Mm.
you're not just asking for help, but also willing to lend a hand. Also figure out, how does your unit deal with conflict communication? Is there a typical way that, is there a generalized way that they prefer it to be handled? For example, one unit that I worked on, because there had been some issues with like nurses not getting along or sometimes not even speaking respectfully to each other in for change of shift report in front of patients and in front of families and whatnot. So they actually had what's called the flip off, which not like what
What?
we normally call it or what that normally means, but you'd actually, if you felt like someone was speaking to you in a way that you didn't feel was respectful, then
Mm.
you'd actually take your badge and flip it up. So you'd flip them off to kind of give them an indicator of, hey, by the way, right now, that tone's not the best or whatnot. Because a lot of times it was people didn't even realize because they're so in their own thing, in their own checklist in their head of what they need to do. So it's not that they're meaning it, but it's because they're thinking, okay, I need to, get change of shift report, do this, do this, do this, do this. And so it was kind of a way to raise awareness. And at first, especially, it would like make people laugh. So you kind of like laugh it off together because of the flipping off component. And so that helped to, really then laughter is the best medicine. And so that helped to build bonding and helped with the communication that everyone was having.
Yeah, it breaks the
Also,
ice for
oh
sure.
yeah, absolutely breaks the ice for sure. Also, just, having a positive, open attitude um, can help contribute, even if you're feeling tired, smile, say hi to people, because that oftentimes can help to contribute. And even if you're exhausted, sometimes smiling and faking it, instead of saying, oh, I'm so tired, I'm so tired, you feel it, say, I'm so tired. And sometimes even just having a smile, it actually does release some endorphins in your brain and helps to pick that mood up. So it can help just contribute to the overall mood of everybody around you, especially because everyone's probably exhausted.
Yeah. Oh, yeah. And oh my gosh, if you work nights, which you probably will, and honestly, I do recommend. We actually talk about this in the new grad prep course of like what is the best shift to start on, and also how to adapt to that. But we go layers deeper. Like right now, guys, we're only covering like the tip of the iceberg here. We go like so much deeper in the new grad prep course because there's so much to talk about. And this is just a few things that are very helpful. But again, if you need more additional help or if you're really nervous, definitely join our new grad prep course. But to this point, if you start night shift, which you typically usually will, there comes a point of like this demon hour, I call it, or like this like death hour, where you literally feel like your body is hurting and like aching.
Mhm.
And it's usually like around like 4 a.m. And you're trying to you're like, gosh, I have 2 or 3 more hours left, and you're like dragging yourself. So definitely real. My biggest recommendation for that, which I learned from Dr. Huberman from Stanford, he was saying that your body, the worst thing you do is when you've already had enough coffee, is to grab another cup of coffee. You're gonna stress out your
Mhm.
adrenals, which adapt to stress. So the best thing you can do, and it sounds weird, but it actually works really well, is you take like a thumbful of salt and then you put it in your water, or you lick it and then drink some water. And the salt, your adrenals, which manage stress, run on salt. So you actually kind of reboot that. It's great electrolytes. It helps to rehydrate your brain, and I've done it multiple times, and it works like a champ. So,
Mhm.
pro tip right there. Oh, were you gonna mention something?
Oh, there was a question I thought I saw. Oh, one about also developing. Someone said that they have, someone in the question said that they have experience internationally in building confidence, even though, they already have work experience, but still feeling not as confident, in this new work environment, especially some of these things like, find someone that you can bond with, that you can ask questions to, but any way that you can also like foster some of that, become a part of the culture, and be that positive part of the culture too. That's going to help you to gain your confidence.
Mhm.
And even if you have to ask for help a lot, because maybe there are some things that are different that you're not, used to, or, you're getting used to the new unit and everything. Still try to offer help when you can, because that's going to help. Nothing builds confidence like you being able to help someone else as well, even if it's something maybe they've never done. So, because especially since you have experience, there might be things that you've done that someone else in the unit, maybe a new grad, and that can help you gain confidence even by helping someone else, especially someone who doesn't have the experience you have. And that can also show a lot as, especially if you're a newer hire, not a new grad on the unit, but a new hire, shows that you're part of the team. So that can really help. And oh yeah, it is. And Nurse Joe, even if your mask is on, smiling can be a big thing. Smizing with your eyes, kind of like how you can tell like if you call like a helpline, or you're calling like a chat
Hmm.
support, and you can tell when that person hates their job,
The tone, yeah.
even if
That's
you can't
true.
see their face, or you can tell if they're actually smiling on the other end,
Hmm.
and just by their tone and whatnot. And so that can actually do wonders.
Hmm.
Which
So true.
another, I was gonna say that kind of goes into another component or another question that we actually got from YouTube. How do you deal with a verbally abusive provider?
Oh yeah.
Especially, lots of times I would always at least try to assume best intent. They might be stressed. And so the way that they're speaking to me is not a reflection of like a personal thing, but it's the situation or maybe all these other things that they're doing, and try to take it with a grain of salt. But especially if they're being disrespectful, if they're saying things like, I had a provider say it to me once, like, "Where'd you go to nursing school?" You're absolutely, and basically insinuating, but not in a nice way. Not like, "Where'd you go to nursing school?" It was, "Where'd you even go to nursing school?" And uh, so I answered the question, let it roll off my back. Or what's the phrase from Ted Lasso? The happiest animal is a goldfish because they have a short memory.
3 seconds, yeah.
So sometimes when you can, let it go. If it's getting in the way of patient care, then definitely it needs to be escalated. If it's something that's where you're not getting orders that you need, or you're not getting the support you need, um, or your patient's not getting the attention that they need, if something's going on, then definitely speak up.
Hmm.
Uh, and absolutely stay professional, remain calm, don't respond emotionally. Try to be as professional as possible. You hope that, if someone loses your respect, still be professional.
Hmm. Yeah,
If the
one of
way
the
that they're acting isn't respectful, you don't have to respect them, but still be professional and think the end goal is patient care.
yeah, and you're gonna meet. Wait, first off, can you guys see my face? Or am I still like blacked out?
Mhm.
Okay, okay. Technology, man. I'm having a struggle day. But yeah, to Professor Allison's point, you will meet providers, especially in like these high stakes environments like ICU, ER, even like telemetry med surg. You'll meet these like providers who come in, like these doctors and stuff that come in like a god complex, demanding stuff, and it's like, who the heck do you think you are, dude? But again, just like Professor Allison said, kill them with kindness. The worst thing you can do is fight fire with fire. It doesn't end well. It's
Mhm.
never recommended, even though you want to. And it's like, you
Mhm.
remember you're new and you don't want to get on anyone's bad side, because I've seen providers report a new grad to the manager, even though the new grad was, correct in saying what they said and, confronting it. Again, tread lightly is our biggest, recommendation.
Absolutely.
Um,
And if it is, uh, especially if it's completely disrespectful, getting in the way of patient care, anything like that,
yeah,
go up the chain of command.
yeah.
Because especially if there's it's incident reporting systems in the hospital, but use that chain of command, because if it's problem not just with you, but lots of other people are reporting it too, then it may be their boss or someone who's their manager needs to address that with them.
Hmm. Yeah, yeah. And most hospitals, they contract with a third party providers or doctors. They have their own group, and those groups have like a lead, or they have their own manager. And so usually you can escalate and talk to your manager, which will float it over to their manager and be like, hey, this is what's happening. And this is not the first time. So yeah, there's a system and way of doing things. All right, guys. So for a time constraint here, We only have about, I'm going to spend about 5 minutes per slide or less so we can have enough time to answer all of your questions. So let's go through this and kind of touch on things, but we can stop where you guys have questions. Okay. Emotional and mental health support. This one is huge. The statistic that's going around, I don't know if it's quantified or not, but what I've heard multiple times is that the average shelf life of a new grad is about 5 years. And some other people are saying it's like 3 years before you want to just totally burn out and go and work at a Botox place or become a nurse practitioner or go to CRNA school or even teach. So remember this, you got to pace yourself. I see a lot of new grads trying to sprint the marathon when they first start and try to pick up a gang of overtime. And then by 9 months into it, they're like, oh my gosh, I need a career change. So here's some tips. First thing is emotional resilience, like we just talked about. It's critical as a clinical skill, and resources are available to help. One of the biggest resources is access to your EAPS, the Employee Assistance Programs, for free counseling if available. There are support groups in some of these bigger hospitals, and there's also like therapists. And I know it sounds weird, like, oh my gosh, nursing, I need therapy, but you kind of do, you know. There's a lot of news, and especially if your first code is going to be traumatic sometimes. I remember one of the areas that I had to raise my hand and be like, I need some help or I need some decompression was when I saw my first pediatric code and we were coding a 1 year old and the 1 year old died and the parents were just
Oh,
in
wow.
disarray. And it was my first time just like, whoa. And I thought I was like a man's man, I can do it. But guys, there's certain things that can hit you a different way and really
Mhm.
rock your world. And the worst thing you do is do it alone. So there are resources out there. Um, so in that situation, everyone who was on the code, we all did a huddle after for a big decompression. And we worked at a Catholic hospital. So I think some type of priest or practitioner came in and they did like some ceremonial thing, like a kumbaya. And it actually was really helpful. I know it sounded like woo woo and crazy, but it really helped me because I was like super shocked. I was like, oh my gosh. So yeah.
And
Um,
there's even certain units that's very common in as far as, like, having, some type of counseling support, especially, like, oncology units. Um, those I know lots of times they'll even have like certain days of the week where even if you're not working, you can come a shift and, talk through some things, especially if let's say there's a frequent flyer patient who is always coming in for treatments and then they pass. That can
mhm.
be really hard for a lot of people because, you get close to those patients that you see frequently, and especially if they have ups and downs and, and you have to witness a really struggling, tense time.
Hmm. And that's the reason why I'm glad that our generation or the younger nurses are using the term self care and mindfulness is becoming more
Mhm.
mainstream. Like, man, back where when the veteran nurses started, probably like in the 80s or even 90s, there was nothing about that, right? It was
Mhm,
just like you just go in, you grind it out, you know. So using apps like Headspace or even Calm for
mhm,
mindfulness and even sleep is really good. I still remember a lot of my friends working in the ICU, and they would go home and still hear the beeps, still hear the blaring beeps
mhm,
when they're trying to go to bed. And it's like, what the heck? And so it's like really like it like screws up your mind a little bit your first 6 months trying to adjust. So using some apps like this, it's worth the money. It's worth the $5 or $10 you're going to pay
mhm,
just to get into a routine of what there's. It's now being called mental fitness, which makes sense, right? Like you go to the gym for your body, you eat for your body, you do a lot of things, but you kind of forget your mental space sometimes.
mhm.
So using something more consistent is builds up that mental fitness and mental resilience.
Absolutely, and then also, there's even some hospitals that have, peer responders,
Mm,
where they're on the units to provide peer support. So thanks, Nurse Joe. Nurse Joe said, like, UC Davis Hospital in Sacramento has that. So lots of different hospitals are providing, unique things that, to provide that support because they recognize nurse burnout is a really big thing, and they don't want to lose nurses because of not being able to emotionally continue forward.
hmm. It's a big thing that more and more people are talking about that they never really
Mhm.
talked about before, right?
Absolutely. Other things, so especially like, so if whether there's a peer responder, just peer support groups that can help because other people who are going through what you're going through, so you don't feel like you're the only one, or you don't feel like you're going crazy, or that you're being over dramatic or anything like that. It can help you to feel validated and heard, and help you to hear, what are some things that are helping other people through it as well.
Mhm.
Especially identifying any signs of burnout and compassion fatigue early, and trying to see what you can do, especially, on your off time, to make sure that you're getting well rested. And so that way, when you're coming in, you're not already exhausted mentally, physically, emotionally.
Mhm.
And so noticing those signs early can be a big, big thing.
Huge.
Also, trying to talk to someone after emotionally intense shifts. Don't just internalize, don't, or sometimes before I'd start driving home, I'd sit in my car and cry for a second. And, sometimes I'd call my mom or call, maybe it was, the person I normally would vent to on a shift. My buddy wasn't working there, but, or working that day. I'd give him a call on my drive home to help to kind of not internalize it, vent it out a little bit, air that out so that way I didn't, carry it and let it be so heavy.
So true. And this is the reason why we're telling you guys that if you bottle this stuff up, there's going to reach a breaking point, and I've seen it before where people explode and then everything comes out.
Hmm.
Um, and this is the reason why it's good to have mentors, or someone who has even, like, has been a nurse a year longer than you, just to have an outlet. If they're a good friend, a good confidant that you can just vent to,
Hmm.
because I've seen it before. I've even been in places before where your partner, who has is going through this crazy new nurse transition, and they're telling their other partner who's like in finance, or someone that does spreadsheets all day,
Hmm.
and they're explaining it to them. They have no clue what they're
Hmm.
dealing with. And if you have kind of like a partner who doesn't, who's not a good nurturer, it's great if you have a Mother Teresa type partner who's like holding your hand, rubbing your feet. But it could feel like you're trauma dumping on them, and it's almost like you're going to overwhelm them.
Hmm.
So again, it's best practice is to find a mentor or someone who's done it before, a year at least before, and ask for their advice. Like, what did you do? And this kind of segues into the new grad prep course, which I know we're talking a lot about, but it's like my little baby. I'm so proud that we just launched it, because it was really a big thing for us. We made it over the course of like last 2 years, maybe 3 years. We put a lot of time into it. But we actually have practical advice of how to identify burnout, and practical advice from a nurse who was actually new, Nurse Lauren, who we interviewed, and also Professor
Hmm.
Allison, of what to do when you feel these signs. And it's all in the new grad prep course, because it's so much we can't talk about it right now. But the third one, to move on because we're time constraints here, Professor Allison, you can touch on this, but talking to someone after an emotionally tense shift and don't internalize it. Oh, we just covered that one. The last one here is to remember that seeking help is a sign of strength and not a sign of weakness, right?
Absolutely. Or needing to talk about it is not a sign of weakness.
Hmm.
Or, sometimes needing to go to the break room. And, for me, I'm someone, sometimes I need a quick, hard cry, like, just 2 minutes, real quick, refresh, splash some water on my face. And especially your ability to like recognize that you need that versus staying on the floor trying to fight it, fight it, fight it, and being distracted,
Hmm.
potentially making mistakes because you're not all there. It's not a sign of weakness, it's actually a sign of knowing your own limitations and having self-awareness. And it helps you to be a better nurse overall.
Yeah, that's the biggest thing. It's like, all we're trying to do is get 1% better every day. You
Hmm.
don't have to be perfect. You're gonna hear us preach that a lot. It's okay to be new. Everyone's been new. It's not that you're dumb. You're just new. Okay. Next is online communities and social media, which I was addicted to, so I had to get an ad blocker for social media. How many of us have actually, like, during nursing school, had to delete Instagram or Facebook momentarily to
Hmm.
focus? I know I have. But in this case, digital spaces can provide connection, advice. There's a lot of Facebook groups. If you have struggled finding a mentor or someone to like really vent to, it's great just to go on these groups and vent. And then you'll see people adding comments and really helping you. Nurses help nurses all the time. And I've seen some great support groups on Facebook. They'll even give you advice and even inspiration when you feel like you're the only one doing this. Sometimes it feels like you're the only new grad ever to exist in the humanity of the world, you know?
Right.
But it's like, no, we've all done this. It's just like nursing school, right? So many
Mhm.
times we internalize nursing school. It's like, it's, oh, me. And you forget that you're in a crew of like a band of brothers, like, and going to war together. So, open yourself up. To do these points real quick, good advice is to follow nurse influencers who educate about how to be a new nurse, and also educational accounts like Simple Nursing, Instagram and TikTok, as you guys know. And then, as mentioned before, joining Facebook groups or even Reddit forums, because you can just trauma dump in there and you'll be surprised. People are going to help you out, and give you a real deal advice. So it's really nice. All right, let's move on to this side here.
So, especially, asking questions, sharing experiences, again, that makes you feel like when people then say, "Oh, no, that happened to me," or "I was in a similar situation," and it helps you be like, "Okay, it's not just because I'm new. It's not just because I'm not good at this. It's not just because I'm not learning as fast as I should be." And so it helps you to build that confidence like, "Okay, other people have been in this position. I'm not the only one." And so that can do a lot to make, for you to take some of that pressure off yourself.
Hmm.
Other things like having virtual events, like things like these webinars and chats, because sometimes even if you see other people's questions, you think, okay, oh, so they also have, a I thought I was the only person or the only one at a hospital who is being paired with my charge nurse who has a full patient load,
Hmm.
or someone who doesn't want to be a preceptor. And so it's like, okay, so I'm not the only one going through that. What are some things that are possible to help make it better? So join these each month, especially get any of those questions you have, even if it's not the exact topic we're talking about. And the questions in the Q&A, we're still good. We'll get to them. Even if it's not this exact topic, we're here to help. It's a community, and we love being here to support you guys. Another thing, try to limit scrolling and comparison to avoid like stress, self-doubt. So kind of like that doom scrolling or comparing yourselves to other people. Like let's say if you did start in a new grad class or there's other new grads, resist the urge to compare where you are compared to them and using that to kind of beat yourself up even more. Because, again, you get to be new no matter what. It is not a competition of who does the best in orientation, who finishes it first. The goal is for you to build your confidence and to be able to have that confidence to then get off of orientation and be on your own.
Yeah, and they always say that comparison is a thief of joy, right? The
Mhm.
grass is always greener on the other side, but at the same time, it's like your new grad experience is unlike anyone else's new grad experience, just like your
Mhm.
nursing journey. So do what everyone progresses at their own pace. It's not a race. It's not a comparison. You do not want to compare yourself and start beating yourself up. And then I call that, it's a self doubt, but I call it the doomsday spiral. Like
Mhm.
when a plane goes down, it's like never good. So enjoy the journey, and don't be scared. Be prepared. Next is family and friends, and I'm trying to make enough time for us for Q and A's. So let's get through this one here. Support from loved ones outside of nursing can help you stay grounded and emotionally balanced, by leaning on trusted friends or even family to talk through your tough days. Like Professor Allison called her mom. But again, just like knowing who to talk to. If someone is not patient, like I would never talk to my brother about this because my brother, like,
Right.
he always roasts me and always like makes fun of like things, and like we call it like poking fun. That's what brothers do. But he's not definitely not understanding. He's not nurturing, and there's so pick and choose your people. And
Mhm.
then next is set boundaries and communicate your schedule and needs, just like you guys learned in nursing school. You had to say no to different parties, different family functions, and then I've heard it a few times where it's like Aunt so and so or Grandma so and so was like, "Where the heck is where are you at? You're supposed to be at this family function." It's like, well, I literally have a test tomorrow, a care plan the next day, and
Mhm.
this there. So just know your certain limits and communicate your schedule and needs appropriately. Yeah. So next, let me see here.
Okay,
Professor Allison, you can
I was
touch
gonna
on
say,
celebrating milestones. Yeah. Oh, sorry.
yeah,
Go ahead.
let them celebrate milestones with you. It doesn't just have to be with the other people in your unit. but help them have them celebrate things like when you get off of orientation or your first month. And so any of those things, or maybe it's the first shift that you know, got all your charting done during the shift and that you didn't have to stay over and chart. Or for me, a big milestone when I was a new grad was actually not charting on my lunch break. I always was charting on my lunch break. And even though other, experienced nurses would come in, be like, stop doing that. You need your break, take your break. But I wanted to make sure everything got done. And and I would come home and, tell my mom about that. And so I remember the first time, I was like, Mom, I actually enjoyed my lunch break. I remember once I was like, I actually got to take a nap on my lunch break. And so that was a milestone. And then I remember it was like a while after, then she was like, remember when do you remember when you always had to do this? Or do you remember when you first started and it was like this? And so sometimes it's nice to like, oh yeah, because you forget how far you've come.
Hmm.
When you're in it, sometimes you forget and you don't see, you see these little baby things, but especially the overall, um, growth that you're having. So especially, share wins, share struggle. Honestly, it helps to reduce that emotional pressure. Because especially, if you come home and you're not, uh, you know, super happy, excited, or don't feel in the mood to, you know, go do something that they want to do, be honest about it
Hmm.
and don't feel like you have to take all that on. And
Hmm.
also learn to recognize when you need space and when you need to have a like when you need someone to talk to. Is it sometimes you just need to like go for a walk? Do you need to, do some physical activity? Do you need to just take a nap? And so different things, have that self-awareness of what do you need and when, and it's okay if it's not always the same thing.
Hmm. I've seen a lot of nurses take like a trip, like a solo trip by themselves, or go to the mountains by themselves, rent a little like cabin or do whatever, like go for a nature walk by themselves just to
Hmm.
decompress. And that's okay. You just got to find what works for you, what best resonates from you. And the best way to really find that is just to feel how you feel after you do that thing. Whether maybe it is nature, maybe for you it's a massage, maybe it's like going to the beach, maybe it's
Hmm.
doing your nails. I don't know. But then looking at yourself and feeling like, oh man, I feel refreshed, or I feel more drained, and that's not it. I got to find something that really, helps me out.
Absolutely. Even because sometimes you can have so much stimuli while you're working, because there's the call lights going off, there's this thing that you need to go do. And but then also, if you have a beeper on or if you have one of those phones and it's always buzzing, and then plus you have maybe your own personal watch is always buzzing. I recently had to, make it so that my watch didn't every time I got a text or an email didn't actually vibrate because I was finding that just that stimulus, getting overstimulated. And so sometimes even, trying to unplug completely. So going for a walk and doing that thing, because too much stimulus can really have an effect on your stress, you're not being able to relax and
Mhm.
whatnot, going home and still hearing the call lights going off or still hearing the IV alarm beeping and whatnot. And so it's good for your mental sanity to work on trying to see what you can do to remove some of those things.
Right. All right, guys, we have about 12 minutes left. So we're going to wrap up this last slide. Then we're going to get to Q&As and answer you guys your Q&As. But before we end, if you guys are just tuning in or maybe tuned in halfway through, I want to tell you about the little baby, actually it's a big baby, that we just launched, called the New Grad Prep Course. It's been in the process of 2 years, actually a little bit more than 2 years. My heart, sweat, and tears went into this. It's like oh my gosh, my little fetus. But basically, it's our new grad prep course. We have about 6 hours of course content for everything you need to know about new grad nursing. We're talking about clinical and workplace skills, how to give report, what to do with charting, how to job search. We sat down with hiring managers from Ivy League hospitals to ask, what do you ask on your interview? So you can be better prepared, so you can know before you go, and you can enter your career with confidence. We also included a skills refresher library, over 100 skills and training videos with cheat sheets and really handy charts, especially if you've never done a Foley before and now you have to do like 3 Foleys in that first week because maybe you work in like an operating room or a PACU. You can simply open and see how to do a Foley in 60 seconds, how to do an
Mhm.
EKG, 60 seconds. We keep it very short so you can like go into the break room, go to the restroom, be like, how do I do this? Boom, you got it. Instead of going on YouTube or on a book, it's like, what do I do? So it's pretty cool. We also offer career guidance and resources. And the best part about this is we have CEUs. It's all the CEUs you'll ever need in one place. You get additional access to 250 other CEU, what's it called? CEU opportunities in the course library. And another bonus is monthly live Q&A sessions, just like you're seeing here. So we are always here to help and answer your questions. So before we get to that last slide in Q&As, I just want to make sure you guys get this because they're doing, I believe, a big discount, 20% off with this QR code. And I feel like I should have a podcast. Use discount code GRAD20 upon checkout and get 20% off. No, but yes, take a screenshot of this if you're interested in it. It really, really is helpful. And it's our baby that I'm very proud about. So let's get to the last slide, jump into some Q&As. All right, the last one is union and advocacy organizations. There's a lot of touchy subjects. There's good and bad about this. I've been a part of a few unions. They're good when they actually do their job, and when something needs to be addressed, it can really help you secure and keep your license safe, especially with patient ratios. But union and advocacy groups can offer you protection, like I just mentioned, but also education and even a collective voice in your workplace. It's best to know your rights regarding workload. Trust me, guys, it's a license you have to protect. And some hospitals are going to try to wiggle room because they are short staffed and be like, hey, let me give you another patient on top of your current patient load, even though it's not legal to have this many patients and
Mhm.
it's not safe. And guess what? It falls on you. If something happens to a patient, like even the Rhonda Vaught case, it falls on you and they're going to persecute you. They won't persecute the hospital or prosecute, I should say. They won't sue the hospital. They're going to sue you as the individual. So be very careful with that. So this is why unions are very helpful. You can escalate to a union and they'll fight for you. It's like Larry H. Parker, like one of those like law firms. Okay. Also, safety and orientation time. They can vouch for you and get you longer orientation time if you need it. Some community hospitals, smaller hospitals, will give you sometimes 10 weeks of orientation, not really show you how to do your job, and then throw you in, and now it's your license on the line. So unions help out with that. Also, too, reach out to union reps with concerns or questions because, again, they fight for you. And you can also join advocacy efforts focused on nursing well-being and safe staffing. So there's power in numbers, and it's best to be a part of an organization that really helps you. So those are the good parts about having a union here. So let's wrap up the last three here.
So definitely, also, try to attend any meetings, stay informed, stay empowered, so being involved. Also know how to advocate for yourself if something's unsafe. A union's there for a reason. And so utilize it, especially if there's unsafe conditions, and advocate for that change. And then even finding mentorship within advocacy groups. So a mentor who's going to be passionate and that's going to help you to know how to advocate for yourself, advocate for changes, and who will help kind of like guide you and lead you in that way.
Mhm. And then let's see here. I'm sorry, I was not tracking. Was that the last one?
Hmm.
Perfecto mundo. All right, guys. I know this has been quick, and we've been hitting a lot of bullet points very quick, but we're going to open the Q&As. But again, if you want a deeper dive, we've just scratched the surface of the iceberg here. If you want a deeper dive and really be doubly prepared, and I always say, like, don't be scared, be prepared, because you're going to be a new grad, and it's kind of like jumping in the deep end, especially if you're at a hospital. Not all hospitals are alike. I worked at Ivy League magnet-studded hospital, which have a bunch of resources. And I've also worked at community hospitals where they have really a lack of resources. And they kind of expect you to know everything that they're supposed to teach you, which kind of stinks. It's like some
Hmm.
nursing schools. So you end up going to YouTube University, and that's how you probably how you got me. So yeah, that's what we're trying to say. All right, but let's get to some Q&As here.
So one that's been here since for a while, so I just want to answer it real quick. Best position for a patient in bilateral soft wrist restraints. Usually it's going to be like supine or semi-Fowlers. You want to make sure that it's tied to a non-movable part of the bed, that it's not too tight, that, the two fingers, that there's a quick release knot and whatnot. But yeah, just supine semi-failures are going to be not failures, Fowlers is going to be a great one.
All right, very nice. I wish I could see the questions. Let me see if
Oh,
I
and
can.
then a few people talked about NCLEX. Definitely, if you're prepping for NCLEX, come tomorrow because we talk about where to start, recommendations, how many questions you should be doing, and how to know when you're ready. And how to know if you need more time to push back your date and whatnot. So I saw one question about don't know where to start. Another one, I don't know if 2 months is enough to study. And so we give those recommendations. And so, oh, thank you, Nurse Joe. There, the link is in there. So we give a lot of that support in those sessions as well.
Hmm.
Oh, any certification that you can do to increase your chance of getting hired, especially if there's like, let's say if you want to work in ICU, then getting ACLS certified, or if you want to work in PEDS, PALS certified, those are going to be great ones. There are some where, like, say if you want to like a specialty certification like orthopedic nursing. You can't do that until you've been an ortho nurse for 2 years. So some of them you can't get until you have some experience. But especially those extra certifications in regards like ACLS is always a good one.
Hmm. Here's a good one. The anonymous attendee said they got their eligibility to sit for the NCLEX. They're super scared, like all of us are. Um, and they're super scared to set their schedule for the NCLEX exam. I don't know if 2 months is enough time to study for the NCLEX, especially if you're not consistent with studying. This person sounds exactly the right person that should be joining our NCLEX webinars, which actually is going on tomorrow. It happens every Thursday. I believe they're happening every Thursday now, or might be every
Mhm.
other Thursday. But we show you everything you need to know for the NCLEX, how to set up your study schedule, how to know when you're ready to take the NCLEX because it's just a numbers game. And we show you exactly how to do that. And also when to push back your date if you're not ready. And it's all based upon certain percentages that you have to be scoring. And we show you the entire 6 week study plan. So, as like a little mental note, join us every Thursday. And if you can't join us, then we also have an NCLEX lecture series that we review and do content heavy. It's basically about 16 to 20 hours of content heavy, everything you need to know for the NCLEX. And that first video is how to set up your study schedule. So
Mhm.
the worst thing you could do is poke around and not really know what you're doing and just take a few questions, a bunch of questions, and not really like focus on your scoring too much and think you're ready and then fail the NCLEX. It's better to be doubly prepared. So I'd recommend joining us for the NCLEX session tomorrow or joining our NCLEX lecture series, which basically breaks it down in even more detail. So yeah, cool. Let's see other questions here.
Let's see, there's a question about can a new grad get a remote job, not necessarily direct patient, like a consulting job, but any RN qualified role? Absolutely, there are remote jobs. There's like telehealth, things like that. We did one of our career nights a few weeks ago, or
Yeah.
not a few months ago, about all the different opportunities there are. So there are some remote jobs, telehealth things that I don't think that they don't hire new grads. So I would say definitely always apply. Even if it says like experience required or experience recommended, still go for it. Because sometimes they may say that in the job posting, but then if especially if you interview well and you have great qualifications for someone who would be great, like doing telehealth or working remote and whatnot, then you could still beat out someone, even if they have experience, based on being able to interview well. And definitely if you're in the interview process, there's lots of different podcasts out there that can help with how to answer interview questions, like the dreaded, what's your weakness kind of thing, or what are your strengths and weaknesses, and how to make that sound, because they want to know that you are accountable and that you have self-reflection and whatnot.
Mhm.
So a lot of those can help with like jogging your mind about what to expect and how to create those answers. So you have a nice, succinct answer. A lot of you probably heard about the STAR method. So, get the situation, what you did, and then what was the outcome.
Mhm.
And so that way, you tell the nice story and wrap it up in a little bow for them too.
Yeah, and we include all those tips and tricks in this new grad prep course. So again, if this is something you're interested in, you can get 20% off today. I don't know how long it's going to last. But just to Professor Allison's point, there's a certain way they're asking interview questions, and there's a certain way to answer it to put your best foot forward. Because
Mhm.
most times you can have the best answer, but sometimes you don't know really why they're asking what they're asking. A great example for an interview question was like, tell me a time you went over and above at your job when no one asked you to, and
Mhm.
especially if you don't have any clinical experience, like no one does, obviously. Um,
Mhm.
there was this one nurse that was, or this new grad nurse that was like, well, I used to work at a restaurant or a bartender or whatever, and the ice machine was broken. And went weeks and weeks, and the manager and everyone was busy, and it's like it was on the to do list. So she took it upon herself to watch a YouTube video and look some stuff up. And it just so happens that one piece was missing. She ordered it from Home Depot or Amazon for like 10 bucks, put it in, and then bam, the ice machine was working. And everyone's like, whoa. So it just goes to show that number one, you're a team player. You go above
Mhm.
and beyond and you do things without people asking you to do things
Mhm.
because that's who you are. And that is a perfect picture example of someone they want on the unit. So you're going to shine out everyone else, if that makes sense. That's just one example of the many that we include inside the new grad prep course. So it's really juicy. Yeah. All right. Anything else?
I don't see any other questions in the Q&A. It looks like, and we're at time.
Yeah.
Thank you guys so much. We really appreciate getting to answer your questions, talk with you guys, provide you guys that support. Remember, you are not alone.
Mhm.
Everyone's been new. And so, whatever you're feeling, likely someone has felt that before too.
Oh, yeah.
So, don't be afraid to speak up, to talk to other people, because it's going to make you feel a lot better.
Oh, yeah. Cool, guys. All right. Thank you guys so much for joining. Sorry, my video was having technical difficulties. That was like really weird, but so cool. I really love doing this. This is nice. It seems like no one's doing this too, which is really cool. Like,
Mhm.
the other big brands, big box brands are not really helping you like we are. So it's nice to make the impact, is what I'm saying. And kudos to
Absolutely.
us. Man, no. All right, y'all.
Pioneers.
Yeah, yeah,
Thank you,
yeah.
everyone. Have a great night.